In 2015, the story of oncology at MSF boiled down to a few lines, mostly devoted to Kaposi's sarcoma, a comorbidity of AIDS patients. 10 years on, the story has expanded. Nowadays, MSF teams in Mali and Malawi offer care to patients suffering from cervical and breast cancers. Our observations then remain valid today. There are no national cancer control programs in countries with limited resources. There is little or no equipment available for diagnosis and treatment, few centralized resources in capital cities, uncertain drug supply, and not enough trained medical staff. Women are the main victims of cancer. Every year, 2.3 million of them die prematurely from cancer. Of these deaths, 1.5 million could be avoided through prevention and screening strategies. The remaining 800,000 could be prevented through quality care. In Malawi, MSF focuses on the country's most prevalent cancer, cervical cancer. This is a consequence of the high rate of HIV infection. Immunocompromised patients are 6 times more likely to develop cancer as a result of infection with the human papillomavirus, or HPV. Hence, the even bigger importance of prevention and early detection for these women. HPV vaccination is now widespread in developed countries, but the vaccine is expensive, and in our countries of intervention, many young girls are still deprived of it. The second component is therefore the surveillance of precancerous lesions for all women between the ages of 20 and 49. In order to detect these lesions as early as possible, MSF teams offer an HPV test to women most likely to have been exposed. The test is efficient and only requires self-sampling. But its high cost prevents it from being widely used. Based on the test results, patients can either be treated or be referred to the hospital for further treatment. Our teams then support women during their treatment journey, with surgery, supplying the Ministry of Health with quality anti-cancer drugs, and sometimes with referrals for radiotherapy. In Mali, our teams are concentrating on cervical and breast cancer. Since it's hard to prevent breast cancer, the challenge is to diagnose it early enough to have more chances of remission. Women presenting with pain or redness in the breast should be able to access an imaging exam. This could be done as part of a woman's medical care, for example, during routine maternal and child health consultations. As far as mammography is concerned, the equipment needed to perform it is expensive and requires trained technicians who are non-existent in the public sector. The examination is therefore reserved for women who can afford it. Diagnosing the type of cancer is an uphill battle, since it requires expensive tests, laboratories, and trained laboratory technicians. This test is fundamental to adapt treatment to the cancer's type and give the patients more chance for healing. Finally, many women still arrive late at the hospital, with their cancer already at an advanced stage. Palliative care is therefore an important component of care, with support both in hospital and at home. By 2050, the World Health Organization predicts a 150% increase in cancer cases in resource-limited countries. What this first decade has taught us is that it is possible to have an impact on women's health. If we want inequalities in access to care to finally be reduced, medical teams need light equipment that is adapted to the terrain and accessible to our patients. For example, we need to develop portable mammograms. Rapid tests to identify high-risk HPV, or more broadly, cancer diagnoses using blood tests, are currently being studied and would enable the wider deployment of high-performance diagnostics. The current HPV vaccine covers 9 types of papillomavirus, but not the HPV-35, which is particularly dangerous and highly prevalent in sub-Saharan Africa. Women living in these countries need a new vaccine that takes them into account. As cancer represents a global public health challenge, innovations should meet every patient's needs everywhere in the world, and access to them must be guaranteed for the most vulnerable populations.